Honorable Chanda is the one who knows how to address me. I feel a little offended we call you Excellency. I'm safer when you call me Governor or just Orengo. That's good enough. But as you know, health is devolved, agriculture is devolved, county roads are devolved, and pre-primary education is devolved, and agriculture is devolved. So as we visit health facilities, it is not by accident. We are conscious of the role that the county government is supposed to play. And one of those sectors is the health sector. And in our manifesto, we put a lot of emphasis and premium on health, agriculture, pre-primary education, and county roads. And of course, with the blue economy, there's emphasis there as part of the big question about agriculture as a whole. We're happy, the doctor, for having us here together with Waziri. From the facilities you have, I think I must say you're doing a good job, but it's not the best because we need more doctors here. I've been told we only have 4 doctors. I think this facility will do better with about 15 doctors, seriously speaking. And also, as Dr. Chanda has said, in terms of facilities, we're grateful that there's an oxygen plant here. We're grateful there are equipment in the Department of Radiology and so on. But the bottom line is that we have to do better to provide a better working environment for the staff who work here, and also to be able to provide better services to the people and the patients who come here. And it is our commitment to make a difference. We're not here to impress people. We are here in our line of duty. And after every visit, we sit down and we try to determine what quick wins we can make or gain, and what can you plan for the near future or for future purposes. One of the things that I think we should address is the water problem, not just in Bondo as a town, but in this health facility. We must put ourselves in a situation where we can have water around the clock. Even the wards that we've toured, again, I think they are makeshift. To be a level 4 hospital, I think even in terms of brick and mortar, we must be seen to be doing a better job. Other counties have done it. I was seeing the other day in Kilifi, they have built a magnificent building to house the hospital there. So we're hoping to make a difference, particularly in the areas that we have pointed out. Out there, if you talk to the public, they see more problems than service, and we must address those problems that people keep on talking about. I also am not happy that the morgue here is not refrigerated. In fact, all the level 4 hospitals, or all the hospitals in Siaya except Yala, the public hospitals, they don't have a proper morgue. And this morgue has got a big population, but thanks to you, the staff here, without refrigeration and by just using chemicals and embalmment, you keep it in that condition. Even me walking into the morgue, and I've been to many morgues before, but I'm surprised that they are kept to that level of cleanliness without refrigeration. So I'm hoping that that's one of the quick wins that we can try to think about. At least Sia and Bondo should be upgraded. We're not just thinking about the dead, but even the living. We need to upgrade the facilities in Bondo. You have enough land for expansion. In fact, in terms of the near future, I think you don't need more land really. This land is expansive for development, and we're going to try and do our best to make appropriate plans to make this facility better for our people, and even people from other counties, because they're not very far from Kisumu County and the other sub-counties in Siaya County. So I hope that in the next days and weeks, we are going to continue to make these visits so that we can see for ourselves what needs to be done and to determine the actions and the solutions for the problems we may face. Otherwise, Daktari and your team, thank you very much. And we'll continue to come here. And if there are things we think we can resolve or solve, our doors are open. And not just for you, but the entire team. And Waziri's team is also there for, providing solutions to the problems you may face. So with those remarks, William, can you come and answer the questions? William is reminding me, and it's better him than you asking me a question. For very practical problems, we have a shortage of drugs, especially in the other facilities, in the dispensaries, the health centers. And we have managed to resolve that issue. But the supplies may take a little time, 2 weeks. I think we're back to normal. What we are promising the people of Siaya, that we don't want to think about drugs when there are no more supplies. I think we'll be more strategic to ensure that there are drugs, at least the basic drugs, available in all our health facilities. Thank you. And now I can answer a question if
yes, maybe.
volunteers, if you read our manifesto there, our vision about them is right there in black and white. We want to mainstream, that service so that they're not paid stipends, but they have full engagement and emoluments that can make them provide more and better service. In fact, they tend to help our health facilities. They're the first point of call. But I can assure you we are not forgotten them, and that's why they feature prominently in our manifesto. Tumemaliza?
Key shots. Ulipata story yote about usiku na sasa kuja kimpromptu. Hello Fred. My impromptu ni my impromptu.
My name is Dr. Michael Odur, Medical Superintendent, Bondo Sub-County Hospital. And today it's our pleasure to have received our new governor, His Excellency James Orengo, who has paid us a visit just to get to see what is happening in Bondo Sub-County Hospital. We have had an interactive opportunity and been able to see what the hospital is offering to the residents of Bondo and Siaya County at large who come to seek services in our facilities. And we are happy, Your Excellency and the Deputy Governor, for finding time to visit us, even as you settle into office, so that as you come in, you are aware of what we are having at Bondo Sub-County Hospital and the Health Department at large. I would not want to take much, but just to appreciate also the good work that the staff in Bondo Sub-County Hospital are doing, and urge them that even as we welcome the new administration, that you continue with the good work that you've been doing. And I'm happy that we have a team that will be supportive. You know, Waswahili husema siku njema huonekana asubuhi. And for us as Bondo Sub-County Hospital, we want to count this as our morning, and we hope that the signs we have seen are signs that predict that this is going to be a very good day for us, okay? I believe there are areas that we may not be doing very well as a facility, and some of those challenges we have mentioned one or two, and we welcome the new administration to even steer us further in terms of service delivery in the hospital. So with those few remarks, just allow me to probably welcome Waziri.
Good evening, ladies and gentlemen. My name is Dismas Wakla, the CEC in charge of health and sanitation. I'm also happy, Governor, Deputy Governor, Mheshimiwa Gideon Ochanda, that you have found time to visit Bondo Sub-County Hospital. Governor, this is really humbling because on Friday you visited Siaya County Referral Hospital, and the next working day you are here in Bondo. That really confirms your commitment to service delivery in the health sector, and we really don't take that for granted. As my MedSoup has elaborately explained, we have taken our leadership through the services we render in this facility, the milestones, the little milestones that we have achieved, and of course the gaps and challenges that exist. This is important because as they settle down to work, it is good that they have a clear vision on what is happening in the health sector. So we really feel privileged, Governor, that you are on these tours, and we want to encourage you that you, at least on the minimum, you visit all the 10 level 4 hospitals in the county, so that it can give you a holistic picture of the level of service delivery in the health sector. Otherwise, I don't want to take much time. I just want to appreciate and welcome the DG. Welcome Mheshimiwa Chanda.
Governor, I want to say this. Number one, this is the first time I'm sharing a platform here with the governor in a health facility in this constituency. Very impressive. And I want to say that as you get into office and as you start working, health is paramount, and we really want to look forward that our health sector in the county is really looked at in a proper manner. I want to believe that this is an indication that we're going to start well. As you go getting the inventories in terms of what happens in the county, we want to wish you well. We want to wish our communities that now they need to look forward maybe to a different way of how things are done. Definitely we've had challenges in this hospital. Some of them extend sometimes to directions where we get in. There's a big problem of water here. I want to believe that this is something that you may want to look at almost immediately. There's been a problem of water. There's a major problem of facilities in terms of the actual physical facilities. What we have here are more very temporary prefabs. A lot of it that were brought in because of the COVID. But we want to believe as you come in, this is a facility that kind of takes care of the entire region, the entire southern part of Siaya, both Bondo and Raila sub-counties. We want to wish you well, and we want to believe that this is going to be a good beginning, and our communities are going to benefit in a proper manner in terms of health services. Thank you very much.
We'll answer the questions. First of all, I think